Hello everyone, in this video I'll be discussing with you on stress and adaptation. I am Rima Stanley, tutor at M College of Nursing, and at the end of this video you will be able to understand the concepts of stress, what is stressor, sources of stress, the effects of stress on the person as well as the models of stress. So now let us see the concepts of stress. Stress is a universal phenomenon as all people experience it and may experience it at any time in their life and, and it is something inevitable. And the person may experience stress in a different way. Their perception may differ from one person to another person. For example, parents refer to stress of raising children, or working people talk of stress of their job, while students may talk of stress with their studies. Stress can result from both positive and negative experiences. For example, a bride preparing for her wedding do experiences stress, and a graduate preparing to start a new job or a stress due to a loss of job. So knowing the concept of stress is important because it provides a way of understanding how the person as a being, how he responds in total, that is mind, body and spirit, to a variety of changes that takes place in daily life. So now let us see what is stress. According to Selye, stress is a non-specific response of the body to any kind of demand made upon it. According to Schaffer in 2000, stress is the arousal of mind and body in response to demand made upon them. So both the definitions says stress is the condition in which the person experiences the changes from the normal balanced state. Now let us see what is stressor. Stressor is any event or stimulus that causes an individual to experience stress. That is, any person or situation that produces anxiety response. Now, stress and stressors are different for each person. Therefore, it is important for the nurse to seek information about stress producers for that person. What is extremely stressful for one person might be relaxing to someone else. When a person faces stressors, the responses are referred to as coping strategies or coping responses or even coping mechanisms. Now let us see the sources of stress. This can be divided into internal stresses, external stresses, developmental stresses, or situational stresses. Let us see each one by one. Internal stresses. This originates within the person. For example, infection, feeling sad. Okay? These are something that also creates stress. Now let us see external stressors. This originates outside the individual. For example, a move to another city or a death in the family or a peer pressure. Developmental stressor. It occurs at a predictable times throughout an individual's life. For example, it changes during puberty, pregnancy, or old age are all some of the examples of developmental stressors. Situational stresses are unpredictable and may occur any time during life. For example, death of loved one, marriage, divorce, birth of a child, new job, or illness. Now, the sources of stress can be further categorized as the environmental stresses, such as noise pollution, traffic, overcrowding, and weather. The physiological stresses such as illness, injuries, hormonal fluctuation, inadequate sleep, or nutrition. And social stresses such as financial problem, work demands, social events, losing a loved one, and thoughts, that is negative self-talk or being over perfectionism can also causes stress. Now, the degree to which any of these events has positive or negative effects depends to some extent on an individual's developmental stage. For example, the death of a parent may be more stressful for a 12 years old than a 40 years old. Now let us see the effect of stress. This might be physical, emotional, intellectual, social, and spiritual. So let us see the consequences of its effect. The physical stress can threaten a person's physiological homeostasis, while in the emotional aspect can produce negative or no constructive feelings about the self. And intellectually, stress can influence a person's perceptual and problem-solving abilities. Socially, stress can alter a person's relationship with others. And spiritually, stress can challenge one's belief and values. The symptoms of stress can be further categorized into body, mind, emotions, and behavior. Example of symptoms in the body includes physical symptoms such as headaches, tough muscles, frequent infections, muscle twitching, skin irritation, breathlessness, fatigue. While in mind, the person keeps worrying, they have muddled thinking, impaired judgments, often have nightmares, and also makes hasty decisions, and negativity, indecisions are all examples of the symptoms under the mind. While emotional symptoms includes loss of confidence, they become more fussy, irritability, anxiety, alienation, depression, and apathy are the common symptoms. And the behavioral symptoms include such as smoking more, restlessness, insomnia, loss of sex drive, driving more, loss of appetite, etc. These are all are the symptoms of stress. Now let us see the models of stress. The models of stress are mainly categorized into three types, and these are stimulus based, response based, and transaction based model. So knowing this model assists the nurse to identify the stressor in a particular situation and to predict the individual's responses. So by using this model, it helps to assist the patient in strengthening a healthy coping responses and in adjusting unhealthy responses. Now let us see the first model, that is stimulus based response. So according to this model, stress is defined as a stimulus, a life event, or a set of circumstances that arouses physiologic and psychological reaction that may increase the individual's vulnerability to illness, such as divorce, pregnancy, and retirement. In this view, both positive and negative events are considered stressful. For example, a divorce may be highly traumatic to one person and cause relatively very little anxiety to the other. So this model was given by Holmes and Ray. Now let us see response-based model. Silas stress response is characterized by a chain or a pattern of physiologic event called as the general adaptation syndrome. So stress can be observed only by the change it produces in the body. The response of the body, that is the stress syndrome or the general adaptation syndrome, occurs with the release of certain adaptive hormones and subsequent changes in the structure and chemical composition of the body. The common affected point during this stage is the gastrointestinal tract, adrenal gland, lymphatic structures, enlargement of thymus, spleen and lymph nodes, deep ulcers in the lining of the stomach, etc. In addition to global adaptation, the body can also react locally, which is referred to as local adaptation syndrome. For example, inflammation. So the general adaptation syndrome or local adaptation syndrome has three stages, and these are alarm reaction, resistance, and exhaustion. Now let us see the alarm reaction. It is the body's initial reaction to a stressor, which occurs when the hypothalamus stimulates the sympathetic division of autonomic nervous system and the adrenal medulla, leading to the release of catecholamines such as epinephrine and norepinephrine, which leads to the alarm reaction, that is the fight or flight responses. Now, the common responses during the alarm reactions are the heart rate and cardiac muscle contractions increases, which increases the circulation of blood quickly to the area where it is needed to fight the stress. The blood vessels constrict, especially the ones that supplies the viscera, except in the heart and lungs, while the blood vessels that supplies the skeletal muscles and the brain dilates. Production of saliva and digestive enzymes reduces during this stage. So these are the common symptoms that a person would experience during alarm reaction. Now let us see the stage of resistance. So in this stage, the body tries to counteract the physiological changes that happen during the alarm reaction stage. The stage is controlled by part of the autonomic nervous system called the parasympathetic. It tries to return the body to normal by reducing the amount of cortisol produced. Now at this stage, the heart rate and the blood pressure begins to return to normal. If the stressful situation comes to an end during this resistance stage, the body will return to normal. However, if stressor remains, body will be in a state of alert and stress hormones continue to be produced, leading to an exhausted stage. So this is how the body responds during the stage of resistance. So whenever there is a stressor, this stimulates the hypothalamus, causing the release of corticotropin releasing hormone, growth hormone releasing hormone, thyrotrophic releasing hormone, which further stimulates the anterior pituitary to release adrenocorticotrophic hormones, human growth hormones, and thyroid stimulating hormones. The ACTH further stimulates the adrenal cortex, which causes the release of adrenal hormones such as glucocorticoids and mineralocorticoids, while the HGH stimulates the liver, which causes which helps in supplying the energy through gluconeogenesis and also by increasing the breakdown of fats, while the thyroid stimulating hormones stimulates the thyroid gland, which also helps in supplying energy through the breakdown of carbohydrates. Now let us see the exhaustion stage. After an extended period of stress, the body goes into the final stage of general adaptation syndrome known as the exhaustion state. At this stage, the body has depleted its energy resources by continually trying but failing to recover from the initial alarm reaction state. Once it reaches the exhaustion state, a person's body is no longer equipped to fight with stress. They may experience tiredness, depression, anxiety, feeling unable to cope. So at this stage, usually the person will have no way to manage stress, and therefore they will be at risk of developing stress related health conditions. Now let us see the transaction models of stress. The transaction model of stress proposes that stress is experienced as an appraisal or evaluation of the situation we find ourselves in. Transaction model suggests we go through two stages of appraisal before feeling or responding to stress. Primary appraisal, we evaluate the situation if it is relevant, whether it will bring a gain or a harm. If it does not, we don't worry about it because it is irrelevant. However, if we feel it is dangerous, we then move into making a secondary appraisal, that is to decide if we have the ability to cope with the situation, such as the risk, uncertainty, or difficulty, etc. And also the resources available around us, such as the social support, etc. If we feel demand outweighs the resources we experience, then we can experience negative stress. And at this point, a person starts to engage in coping strategies. So as you can see, the coping strategies can be personal attributes, such as and also stable environment attributes, or emotional or problem focused coping. So the emotional or problem focused coping provides a short term outcome such as relaxation and stable mood, however which also further in later stage can affect the long term outcomes such as the physical health, the mental health, and the life satisfaction of the person, which also might influence the personal attributes and the stable environment attributes of the person. So with this, we have come to the end of the session. The keynote: stress is a condition in which the person experiences changes in normal balance state, and there are various factors that influences the development of stress, and each experiences the stress in a different way. References: Mary C. Townsend, Psychiatric Textbook for Nurses, www.nimhans.government Health Topics, also www.webmed. Thank you.